Thanks, guys. Yeah, Happy New Year. Speaking of New Year, many people decide that it's time to update their looks, and that includes cosmetic procedures. So what's popular, you ask? Well, we got the expert here to ask him. Dr. Young Cho joins us now. What's the deal? What are people talking about these days?
Good morning and Happy New Year. When people come to me and they ask me, what can I do to look a little more refreshed or younger, what they're often looking at is themselves in the mirror and noticing some visible signs of aging.
Okay.
Some of the things that occur with aging is that we lose volume in our face. This volume can be lost along the temples, under the eyes to create the tired look. Our cheeks can become a little recessed. We can develop folds around our nose and our mouth, even along the sides of the face. And to combat this aging process, a great service and a great product are dermal fillers, which we have some over here. Okay. It helps to revolumize some of the areas where we've lost volume and helps with the aging process.
What's the difference between a filler and Botox? Is there a difference?
There absolutely is a difference. It's a big difference. So people often get the terms confused because the term Botox is so popular. But Botox and Dysport, these are neurotoxins that act to weaken the muscles. So Botox and Dysport are very common along the frown areas.
Which is why your forehead doesn't move, right?
Correct. Or when you raise the brows, you have lines here, or the crow's feet along the sides of the eyes when you smile. Volume, like fillers, what they do is they fill in areas where there's shadows. So areas that we mentioned here, where there's the temples, the cheeks, underneath the eyes, and so forth. A
lot of people may be afraid to go under the knife. This is not that. This is a cosmetic procedure.
Correct. These are definite cosmetic aesthetic procedures. They are minimally invasive, meaning there is a needle involved, but there's no knife involved. You don't have a scar. You may get a little bit of bruising and swelling associated with it, but not everyone gets that either. And it's done in the office. It's a relatively short procedure.
Oh, that's what I was just going to ask. How long? So if folks go in the morning, they can expect to be out within the hour, or?
Most commonly, yes, within the hour. If we're putting some numbing medication on to help with the discomfort, it may take a little bit longer for the numbing medication to take effect. It's usually topically applied. And then the procedure itself just depends on how much volume you're receiving, but it can last anywhere from half an hour to over an hour.
Okay, what else did you bring in for us today? So these are the fillers, right?
So these are all fillers here. Okay. So they're all different types. They're made by different manufacturers. They're all relatively safe to use. Some of the ones that you see up front, they are also reversible. So if there are any concerns that you have, you can always put in an enzyme that helps break down what you just placed. Okay,
you mentioned there are different brands. Last question for you, because we have a couple of seconds left, is how do you know what brand to go with, and what's the payment like?
So the brand can be somewhat driven by what patients have. If they say, I really want Restylane because my friend had Restylane, then I have no problems using Restylane. More often what I'm doing to help select which product, each one has a little different characteristics. Some are thicker, some are thinner, depending on where we're putting it. If I'm putting in areas where there's thin tissue, I want to use a thinner product. Areas where we have deeper folds that we're trying to fill in, then I'll use a thicker product because that might affect the longevity of the result.
Last question for you, just a few seconds. How much are we talking about? What's the price?
So these can range anywhere from a few $100s to a few $1,000s depending on the amount of volume that we're using and the number of syringes that we're using.
All right, new year, new you. Thanks so much, Doctor.
You're very welcome.
For coming in this morning. We really appreciate it.
Okay.
So I was going to say we all have them. I guess we don't all, but most of us, myself included, have them. Those little spots that just won't seem to disappear no matter how much we exercise and watch what we eat. For some, that means turning to a plastic surgeon as one option. So with more on the different options available is board-certified plastic surgeon Dr. Young Cho. Thank you for coming in on this Sunday morning.
You're very welcome.
And so let's start by having this discussion. It's the new year. A lot of people are trying to get a new body. That starts with diet and exercise. You're not discounting that, right?
Absolutely. So probably the best way to get the shape that you're wanting for is really to figure out, are you on a good diet and exercise regimen? So we can't underestimate the importance of that.
So healthy lifestyle is #1. But then a plastic surgeon could come in and help you out a little bit. What is Coolsculpting?
So Coolsculpting is a device that's non-invasive, meaning there's nothing that's going through the skin. And it is a device that cools the fat cells in an area of concern. And it basically stresses the fat cell to a point where they say, I've lived a long, hard life, it's my time to go.
Oh yeah, we like that.
So as a result, what happens is those fat cells get cleared through the body over the next several weeks and months, and then you have a reduction of the number of fat cells in that area. So if a given pinched area, you can see a good 20+% of your fat cells reduced in that area.
So how do you know if you're a good candidate for this?
So first of all, again, to reemphasize, you need to be at a very stable place in terms of diet and exercise or your lifestyle. So your weight's not fluctuating up and down, because that's going to overshadow any results that you might see. If you're at that point and you say, well, no matter what I do, I can't get rid of this, and it be a pinched area that just bothers you, whether it's the love handles, the lower abdomen, the inner thigh, sometimes it's the bra area where you have tissue bulging out, or the arms, and those are all areas that can be treated as long as we can pinch and pull. And if you say, well, no matter what, I'm not looking for something surgical, I'm looking for something non-invasive, then Coolsculpting can be a good option for you.
And how do you determine, or do you just have to try it, who this really works for?
Well, it does work for everyone that is a candidate.
Okay.
So perhaps a different way to ask the question is, am I going to get the results that I'm expecting? So if I'm looking at myself and I see a lot of loose skin and fat, then Coolsculpting may not be the best option. That's where we're talking about tummy tucks or arm lifts or thigh lifts or stuff like that, because we're physically removing skin.
I was going to say, I just came off maternity leave, so you might be talking to some women that have had babies too.
Correct. So depending on the amount of skin laxity that one has in the abdominal area, they might be a candidate for a tummy tuck versus liposuction, versus if they have good skin tone and it's just a little problem area, then Coolsculpting is a great tool for that.
And let's talk about cost. What are the cost ranges on some of this? I know it's going to be different depending on what you need.
Sure.
But what can you tell us?
So it depends on several factors. The areas of concern, whether we're using large applicators or small applicators. The cost can start as low as $1,200 or so and can go up. Sometimes it becomes more expensive than surgery itself if you're doing multiple areas, and you might be able to achieve that same outcome. They're just really looking for non-surgical options, so they're going for multiple applications.
Last question, really important for a lot of people. You've said repeatedly non-surgical. How about pain? What can people expect at a treatment to experience?
That's a great question. So the treatment itself is very well tolerated. The first several minutes are fairly intense because you're physically pulling tissue in, then you're cooling it down. Most people are able to watch movies, read a book, listen to music for the bulk of the treatment procedure. And then afterwards, it's really well tolerated. You can go back to work. There may be some areas where you get a little hypersensitive afterwards. Very few people are needing medications to help with that, but it's certainly not something that's going to cause you to miss work or have downtime associated with it.
Dr. Young Cho, thank you for coming in today.
You're very welcome.
Sure, for more information about Coolsculpting and Dr. Cho's practice, you can head to our website at abc13.com.